Well, good evening and welcome, everyone. I appreciate you joining us here this evening. It's a pleasure for me to welcome and thank you on behalf of the boards of directors of both the Mary and John Elliot Foundation, but also the Elliot Health System Board of Directors who are here this evening. It's a special thanks that goes out to you because each of you are making a lot of the contributions that we're able to make back to the community special here this evening by supporting the efforts of New Hampshire's Hospital for Children. Many of you may not know this, but this is the 14th year that we've provided to the community the gala in recognition of the Mary and John Elliot Foundation. And over those last few years alone, we've raised in excess of $1 million to benefit New Hampshire's Hospital for Children. That $1 million goes to support a number of different things, not only the professionals and the staff that comprise the myriad of different specialty services and primary care services, as well as inpatient services at Elliot Hospital, but also giving back to the community in a special way. Previously, Southern New Hampshire did not have a dedicated pediatric service. You were either going to go north or you're going to go south, but it was not available in the immediate community. And several years ago, Elliot Health System made a decision to invest in the community. And many of the practitioners are here this evening, so that $1 million that we have been able to raise has gone to support much of the technology that we rely on each and every day for some of our smallest and most vulnerable patients, but also the professionals and the staff that comprise New Hampshire's Hospital for Children. So for that, we very much thank you this evening. We have a very brief program tonight, as has been our tradition at this event. First, I'll be making just a few introductory remarks, and then I'll be turning it over to a guest speaker we have this evening, before turning it over to Ann Remus as chair of our Mary and John Elliot Foundation chair. So before I do that, though, I would like to extend my thanks to a few folks that do need to be recognized here tonight. First, to carry out an event like this, as you can all imagine, those of you that attend probably a large number of these, it's an awful lot of work. It doesn't begin 30 days before the event. It begins several months before the event. And there's a lot of last-minute preparation, and Mother Nature sometimes will impact us as it has today. But I would like to extend a thanks to all the volunteers and staff at Elliot who have made this evening such a great success for us tonight. So if you could join me in a round of applause for them. Secondly, we have the great privilege of being led by two different boards. The Mary and John Elliot Foundation Board, chaired by Ann Remus, who dedicate their time and attention without any pay, without any compensation of any kind other than a few chicken dinners every now and then, to support the efforts because they believe in the organization, they believe in what we provide back to the community. And I would like to recognize Ann here this evening, but I would also like to recognize Diane Mercier as chair of the Elliot Health System Board, both of whom and their peers on the two boards really do so much to provide leadership to our organization. We thank them very much for their commitment. There are also a number of members of our medical staff who are here this evening who provide care again to not only our adult patients, but New Hampshire's Hospital for Children patients, our most vulnerable. And I would like to recognize them because if it were not for you, we would not be here today and we would not be providing the quality care that we provide. So thank you very much for all you do each and every day. Also, New Hampshire's Hospital for Children has an advisory board that was very much instrumental in this evening's event and putting it together. And I know several of you are out there in the audience tonight, so I did want to certainly make a nod to you and thank you for your efforts throughout the year, but especially related to tonight's event. Very much appreciated. Many of you may know that over the last few months we've had a need to kind of do some double duty with regard to the foundation. We've had to ask some people to step up and take on additional responsibilities related to the day-to-day affairs of the foundation, but also in planning for tonight's event. And I'd like to recognize those folks because what you don't know is what you don't see, and what you don't see is what goes on day to day behind the scenes in planning the day-to-day affairs of the foundation, making sure that everything goes well, but also planning major functions like we have this evening. And there are three people in particular that I'd like to identify and ask them to stand and be recognized by the group. One is Rick Elwell, our Chief Financial Officer, who stepped in to oversee the financial affairs and oversight of the foundation. Thank you, Rick. Second is Megan Durkee, who has been the development specialist, but also stand-in vice president for the foundation. Megan, thank you so much. Well done. Megan has gotten extremely high marks from everyone she's come in contact with over the last several years, but importantly over the last few months, and I greatly appreciate all that you've done, Megan. Thank you. And Karen Cookson, who without her efforts, we would not be here tonight. So Karen, thank you so much. In the spirit of announcements, you may be wondering what is the status of the Vice President of Development position with the Mary and John Elliott Foundation. Well, I have some good news to share with you. We announced earlier this week the appointment of Nick Zarias as the new Vice President of Development. He's not here with us this evening by design, but he will be joining us officially on October 23rd, assuming his duties at that point in time. And you'll have a chance to meet him through a variety of different receptions that we're going to be holding over the course of the next few months, but also certainly through events like this. Nick brings a tremendous amount of experience with him. He's got experience both in terms of academic. He has been at the Tilton School. He's been at the Choate School, Choate Rosemary Hall School. And most currently, he's been with Lawrence General Hospital in Lawrence, Mass., where he's raised just in a couple short years over $14 million. So we have very high expectations for Nick. We look forward to introducing him to you in the coming weeks. And again, his development background, his personality, his fit with our management team, his fit with the foundation staff, I think we're very much looking forward to. Nick lives with his wife in Derry. They have one grown son who's in college on a soccer scholarship. And they do have a lake cabin, I'm told, out towards Peterborough in New Hampshire. But so their home has been and continues to be here in New Hampshire. We look forward to introducing you to Nick as the months go on. Now what I'd like to do is introduce to you this evening's speaker. It's a special guest to say the least. Nicole Ledoux has been very involved in our community as a police officer, detective, in a variety of different community venues that I've had the privilege of interacting with her on, not the least of which is pediatric-related issues, but also mental health issues, which, as you know, is a significant area of concern nationally, but certainly in our greater community. Nicole served as a police officer with the Manchester Police Department for over 20 years. The last 7 years, she's been directly involved in investigations of child physical and sexual abuse, both as a detective and as a supervisor. She currently holds the rank of Detective Lieutenant, overseeing the Juvenile Investigative Unit and the Domestic Violence and Sexual Assault Unit, things we wish we didn't have to have. She's a Granite State Children's Alliance Executive Board member, as well as a New Hampshire Hospital for Children Advisory Board member. She's also a wife and proud mother of a 7-year-old son, and she's the only person I know who comes packing to meetings that I attend. So it's a delight for me to be able to welcome Nicole to the stage to tell you her personal stories. So thank you, Nicole.
Good evening, everyone. I'm not packing tonight. I just couldn't find anywhere to put it, to be honest with you. I'm kidding. Meg, Michelle, Karen, thank you. Beautiful. Thank you very much. Great job. I bet you're wondering why there's a lieutenant from the Manchester Police Department standing in front of you speaking at a New Hampshire Hospital for Children Gala, right? I mean, doesn't seem like the right fit, right? Maybe a family that had a sick kid or a child that was treated at the hospital, but I'm here tonight to talk to you about something that really doesn't get talked about at dinner parties and fun events because it's a tough topic to talk about. But it's a real issue in pediatric healthcare, and I think it's something that I'm happy to be able to educate you about a little bit. Often when we think of pediatric healthcare, we think of kids that are suffering from long-term diseases or children that have been injured in tragic accidents, or maybe a baby that was born really prematurely. But we often don't think about our children that come into the healthcare system because of inflicted injury. Because some adult somewhere in their life, usually a caregiver, has chosen to hurt that child. And it's easy to understand why we don't think about that, because thinking about an adult hurting a child doesn't resonate well with us. But the truth is that physical and sexual abuse of children is a real pediatric healthcare issue. And oftentimes a physician, a nurse, or a hospital social worker is the first person to recognize that there might be an abusive issue involved. I'm not going to get into statistics because statistics are boring and I don't want to bore you. But I will tell you this. From 2014 July till 2015 July, the Manchester Police Department had 265 cases of child physical and sexual abuse. 265. That's almost as many kids as there are people in this room right now. And that number's for Manchester only. Keep in mind that the Elliot Health System serves all of the surrounding communities and kids from as far south as maybe Massachusetts and as far north as, who knows, maybe as far north as the Canadian border. Child abuse knows no boundaries, not religious, not socioeconomic boundaries, not geographical, not ethnic, nothing. Every child in every community could be a victim. So why am I here talking to you about this tonight? I'm here to tell you that your presence here, your continued support of New Hampshire Hospital for Children, makes a difference for kids in our community who are victims of both physical and sexual abuse. It makes a difference because when you support New Hampshire Hospital for Children, you support the great doctors, nurses, and social workers, and the other staff who work with these kids. So I want to tell you a little about the people that I've worked with from NHHC in my job that have made a huge difference in many kids' lives. Nurses like Mary Remillard, who's working toward developing a pediatric sexual assault nurse examiner program, which they have at the Elliot, but she's working on developing a full-time staff that can do that for kids who are victims of child sexual abuse. Not only is Mary working to develop that program at the Elliot, but she's reached out to Manchester PD to say, how can we better serve you? How can we work with you to serve these kids? Doctors like Amy Roy. Amy's my buddy. So, Amy, are you here? I don't know if she's here, but. Let me tell you a little about Amy Roy. I've called Amy Roy about kids who have come into the ER, and she's called me back from the beach. She's called me back from her car. She's called me back when I can hear her kids yakking at her in the background, and I get that because I have an 8-year-old son who yaks at me constantly. She calls me back when I call her. I can tell you, because I've been with the Manchester PD forever, that before NHHC was around, doctors from hospitals that are great hospitals but aren't in our community, you couldn't get them to call you back. And Amy always calls me back. And she always helps me with whatever issue I'm having. And she's reached out to me to say, hey, Nicole, how can we better educate our ED staff to recognize signs of physical abuse, and how can we better educate them to know when to call you at MPD so you can come and you can help these kids. And we've done training. We've worked together to put training on for the ED and the PD-ED staff, and she's great. So thank you, Amy, for just being you. Doctors like Mike Miller and Adrian Thomas, who on their own time volunteer to be on the board for the Granite State Children's Alliance to make sure the kids who are victims of physical and sexual abuse have access to good forensic interviews and good referral services for mental health treatment. On their own time, they dedicate their time to that. Let me tell you about my first experience with Mike Miller, who's a great doc and a great guy. But when NHHC was first coming to be, we had a homicide case with a young child who drowned, and I had always dealt with different hospitals, not hospitals here, great hospitals, just not in our community. And I went in to talk to Mike about this child, and I figured I'd get 5 minutes in an empty ED room, and he'd tell me what happened or what his perspective of what happened was, and I'd write it down in my notes, and that would be the end of it. Mike took me into his office, spent 45 minutes talking to me about how what may or may not have happened to this kid and how they treated him and this and that, and then walked me around the hospital to show me where the PICU was going to be and how excited he was about how we were going to have a PDED and just the different changes that were going to be made at NHHC. And I'll tell you that if we call Mike, he calls us back. If we email him, he emails us back. If we need something from him in the case, he's there for us all the time. And Adrian's the same. Adrian fights to say, let's do what we can for kids who've been abused. Let's make sure they have the services they need. And they're just fantastic, and they work with us whenever they can, and they're really dedicated to the cause. They're great docs. And doctors like Wendy Gladstone, who's not here tonight, I know, but she's the only board-certified pediatric abuse specialist in New Hampshire, the only one. There's one for New Hampshire, one for Vermont. I can tell you that we use them a lot. And Wendy comes to our case review meetings just to sit with us and answer questions. Wendy, we don't understand why this medical thing happened, or we don't understand this diagnosis. And she sits with us. And when I say us, I mean myself, my detectives, the prosecutors, and she explains to us what we need to understand so we can move forward in prosecution. She also gets countless referrals from us. When we have a kid who's been abused, we can send him to Wendy. When we have a kid in the ED who's been abused, she comes in. Whenever we call her, she always comes in. She's very dedicated to dealing with the issue of pediatric child abuse, and we appreciate her very much. And she's retiring in March, and Mike Miller is already spearheading the search for someone else, so we appreciate that. In closing, what I'd like to tell you, and what I hope you take with you tonight, is that although child physical and sexual abuse is not something that is easy to think about or talk about, is a real-time issue in our area. And NHHC and their staff of amazing doctors and nurses and social workers stand with your local police department, prosecutors, and child protective social workers on the front line of the fight to end child abuse. Your support of NHHC supports the work that they do to identify, treat, and get resources for children who are victims of crime. Your support of NHHC helps child victims of crime, and for that, I thank you.
Thank you, Nicole. That was powerful and just points to how transformative it has been that the New Hampshire Hospital for Children has been developed. I'm Ann Remus. I have the honor of currently being the chair of the Mary and John Elliot Charitable Foundation, and I just want to take 2 minutes, and that's all, because you want to be getting on to dinner. But I need to say how grateful we are that all of you have, many of you have been many, many years our friends. For those of you that are relatively new as our friends, we hope we keep you as friends for a long time, because the children in the greater Manchester area and way beyond, you are serving them in ways far wider and deeper than you may even know. So we're grateful. Your both friendship and benevolence do not go unnoticed, and I just want to be able to say, on behalf of the Mary and John Elliot Charitable Foundation, thank you so, so much for being here and for your continuing support. Thanks.